Welcome to the COVID Fireside Chats. This is the March 2021 edition of the COVID Fireside Chats hosted by the Bay Area Disc Association and me, Dr. Harris Masket, Chief Urgent Care Physician at UC Berkeley. The purpose of these COVID Fireside Chats is to give you all of the latest scientific information so that you can take care of yourself, your family, your community, and know when you can get back out there and start playing ultimate frisbee again. Thank you for joining us. We have been doing these for over a year, and today on the Fireside Chat, we are going to talk about the vaccines, which seem to be working. Then we're going to talk about the variants, which seem to be growing. And then we're going to talk about sports and when you can get back out there with your body. Okay, first, the vaccines. So, the vaccines are working. So far on this planet, as I say this, we have vaccinated about the equivalent of the population of this world in 1000 AD. That sounds like a lot to me. And what we've seen is there are no surprises so far with side effects. And there are also no surprises with how well it's working. It's working really well. If you want to see how well it's working, there's terrific data coming out of Israel. Israel has been ahead of the game. They have more vaccine and a much more organized process for delivering it than many other countries. And what it's showing us, as they are 1 or 2 months ahead of everybody, is what it looks like when a country gets to that stage, and they are doing really, really well. They have vaccinated the majority of people over 60, and their cases are going way down. Hospitalizations are going way down. And one other really important thing, which I'm excited about, transmission is going way down. Now, when I say transmission, what do I mean? I mean, one person with the vaccine and another person with the vaccine don't spread it between each other and give it to somebody else. Why would that even happen? Well, that was a theoretical possibility. And the way we made these vaccines, we didn't make them to stop transmission. The way we made these vaccines is to make them turn coronavirus into a mild cold, if that. So that if we all got infections, who cares? Well, that's what they were trying to do, and they seem to be doing that. When you get this vaccine, it seems to keep you from getting it, or if you get it, you really don't get that sick. But we didn't know if it would prevent transmission. We needed a whole population to get the vaccine and then see. Well, in Israel, that's happening, and transmission is going down. We are so excited about this that the CDC has even changed some of their recommendations around quarantine. Check out the CDC website, and you'll learn that they have changed some of the requirements about quarantine for people who are fully vaccinated. Now, do we know exactly how much it keeps transmission from happening between people? No, we don't. Sorry. But I know that it does. If I had to guess, well, this is a scientific kind of podcast, videocast, so we don't know exactly. But if I were to guess, it's somewhere between 40 and 80%. Now, well, what does that mean? What does decreasing that transmission mean for you? Can you and your vaccinated family member hug each other? Well, what you have to look at is your individual risk and the risk of people around you and the risk of transmitting the virus to somebody who isn't vaccinated, can't get vaccinated, or somebody who would have a really bad outcome if they got sick. So I can't tell you whether or not that means you can hug your grandparent or something like that. But I can tell you that the chance of you having transmission is very, very low if you are fully vaccinated. And that is wonderful news. Now, if you haven't been vaccinated, I want you to get vaccinated if you can. Please check out the, if you're living in the state of California, myturn.ca.gov, and that's how you register yourself. Now, the CDC still recommends, and I still recommend, that anybody who's vaccinated interact outside with people if you can. Wear a mask. Keep your distance. Do all the other non-pharmaceutical interventions. Do the basics. Don't share equipment with each other if you can, and if you have to, clean it and clean your hands. All of the basics are still in play. But we feel like we are starting to win this battle, and that is the exciting news about vaccines. Okay, now let's talk about the variants. Variants are mutations in the virus. The virus is always trying to spread to more people, and it's doing so by basically having a survival of the fittest. It creates new versions all the time, and when these new versions are named by either the region where they're discovered or by the genetic mutation. We put it here. So these are one of the terms for the types of variants. There's called the UK variant. It's got other terms that are based on the actual genetic mutation and how you name those, but I like these names better for all of us. The United Kingdom version, then there's the boosted United Kingdom version. That's my name for it. There's the South Africa variant. There's the Brazil variant. And now there's this California variant, which seems to be growing in our state and across the country. All right, what do you want to know about variants is, are they more transmissible? So we'll talk about, do they spread more easily? Are they more severe? And do they escape our immune system if we are immune to them because we had a previous infection or because we had a vaccine? So let's talk about transmission. All of them seem to be more transmissible. They spread more easily. And in a recent study about transmission, it seemed that the United Kingdom variant might be spreading more easily between us because it takes us longer to develop symptoms, meaning we don't know that we're contagious for a longer period of time, and because we are more contagious for longer, meaning we're used to thinking that we're isolating for 10 days and then we're safe. Well, with this version, it might be longer than that, and that's how it's increasing its transmission. So we are learning as we go. What about severity? The United Kingdom variant is more severe. The United Kingdom boosted variant is probably more severe, but we don't have great data yet. We don't know enough about South Africa and Brazil, and we don't know enough about the California variant. It's brand new, but it does appear to be likely to be more severe. All right, let's talk about some immune escape. So do these new versions of coronavirus escape our immune system to some degree? And the unfortunate news is that, yes, they escape our immune systems to some degree. So whether or not you had a previous infection with one of these versions or another version, or you're immune because you had a vaccine, these versions seem to be escaping our immune system to some degree. That doesn't mean completely. That doesn't mean they escape so much so that if you've had a vaccine, you will have the full effect of this virus. You probably will not. Our immune systems are still there and they're still active, but there is some effect, and that's something we're going to have to watch as we learn more about this over time. Okay, now let's talk about sports. Now, you might ask, why am I talking about sports when there are all these nasty variants out there? Well, here's why. The variants have been out there for a little while. And one thing we've learned throughout all of this pandemic is that sports, outdoors, low and moderate impact, and with a mask on, is a very low-risk activity. There are almost no cases where it's spread. Now, if you're talking about indoor sports, there's more risk. And if you're talking about no mask, more risk. And if you're talking about heavy levels of contact like water polo or like football, then you're talking about a lot more risk. But still, it's a low-risk activity playing outdoor sports with each other. So much so that you're seeing sports popping up all over the place and there's not a lot of transmission. Now, there is a lot of transmission when athletes gather for dinner afterwards or when they drive in the car to and from the event. So that's what we have to be watching for. But the state of California just released some really carefully worded guidelines about returning to sports, and the Bay Area Disc Association is carefully looking at those with their experts to try to figure out how you can safely get back to playing ultimate-like activities, if not fully ultimate. So, what I'm going to recommend you do is what the people in Portland do for 8 months of the year when it's raining. They put on a raincoat and they go outside. So that's what you should do. Put on your mask, go outside, follow all of the non-pharmaceutical interventions like distancing and keeping your hands and your equipment clean, and interact with each other. If you do that, it is a very low-risk activity, and it's time for us to start moving our bodies around, even if it's just the training wheels of just starting, just doing the basics. I just brought my team out there, the high school team that I coached last week, and we just had to move our bodies around a little just to remember what that's like. But it's so useful. It made me so happy and everyone on the team so happy. It's good for our bodies and our souls. So I'm encouraging you to do that safely. All right. I want you to send questions to the Bay Area Disc Association for our next talk that will be coming in a month. I want you to share this talk widely because you are the leaders of the world with this information. You are getting all of the correct information and spreading it to your loved ones and your communities. And I want you to keep paying attention to these, and I will see you in a month. Take care.